If you or someone you know is struggling with trauma or mental health challenges, you're not alone. Can psychedelics help veterans with chronic pain? By Rapid Mental Healing for Veterans nonprofit. Many veterans suffer from dual epidemics of chronic pain and opioid dependence. Can psychedelics help vets curb addiction and fight chronic pain? Marine Corporal Craig Schroeder served in Iraq in the Triangle of Death. One day, a makeshift bomb left him with a traumatic brain injury, broken foot and ankle, and a herniated disc. In addition to hearing and memory loss, he is one of many veterans with chronic pain. Veterans are the tip of the spear when it comes to chronic pain, opioid dependence, and overdose deaths. But they're also at the forefront of new research showing psychedelics may treat chronic pain more effectively than opioids, without the risk of dependence or overdose. Combat and chronic pain. Nearly half of veterans who see combat come back with chronic pain. In one survey, nearly half of veterans with chronic pain had suffered for at least a year, and more than half were in pain constantly or daily. By contrast, 26% of the general population suffers from chronic pain. More than half of these veterans rated their chronic pain as moderate or severe. Over the past 10 years of the most recent psychedelic renaissance, VA hospitals have been epicenters of randomized, controlled trials on using psychedelics to treat conditions like PTSD, anxiety, and depression. First, veterans are more likely to suffer from these conditions. Second, Virginia hospitals provide controlled environments which are in many ways ideally suited to running these types of trials. Thanks to these studies, we have fairly robust preliminary data on the effectiveness and safety of using psychedelics to treat psychiatric problems such as PTSD, anxiety, depression, alcohol dependence, and more. When it comes to chronic pain, the evidence is thinner and more preliminary. Researchers are still very much in the early stages. But the evidence that's coming out is promising. And with so many studies in the pipeline, we should know a lot more before long. It increasingly seems that pain, one of the most universal experiences in the human condition, is now the next frontier for psychedelics after mental health, Vice reports. People are finding healing with psychedelics. In 2021, the New York Times profiled Jose Martinez, a former Army gunner who was injured in Afghanistan. After 19 surgeries, his chronic, debilitating pain left him dependent on opioids. Then he tried psilocybin. He's since become an effective psychedelics evangelist. Psychedelics helped me realize that my problems are small compared to the world's bigger problems like starvation and cancer, Martinez said. Now I understand what I'm here for in this world, which is to make people smile and to remind them that life can be beautiful even when it's not so easy. He's still in chronic pain. But today he's a Paralympic surfer, an archer, and a weight training enthusiast. He also runs a nonprofit that seeks to connect veterans to nature through wilderness outings. Martinez is far from alone in using psychedelics to effectively treat chronic pain. Individual experimentation helped launch UC San Diego's Psychedelics and Health Research Initiative, PHRI. In 2016, Qualcomm Institute research scientist and National Geographic explorer Albert Eamon Lin lost his lower leg in an accident in the desert. Lin soon began experiencing debilitating phantom limb pain. A single session with psilocybin gave Lin immediate, persistent, and profound pain reduction. Freeing myself of the pain gave me back my life, says Lin, who is the director of the Center for Human Frontiers based at the Qualcomm Institute. Vice reports that thousands of people have treated physical pain with psilocybin. The potential benefits of psychedelics. Unlike opioids, psychedelics aren't addictive and are extremely difficult to fatally overdose on. Psychedelic substances have a generally favorable safety profile, especially when compared with opioid analgesics, reads a review paper in a 2020 British Medical Journal publication. Psilocybin may pose cardiovascular risks, but so far only in cases of chronic, heavy use. The other problem with conventional treatments for chronic pain is that they're not always effective. Lin first availed himself of the state-of-the-art treatment for phantom limb pain, mirror visual feedback overseen by the authority on the topic, V.S. Ramachandran. But it provided temporary relief. When the mirror was removed, the pain came rushing back as if my mind just wouldn't let it go, Lin said. Neuropathic pain conditions such as phantom limb pain are often difficult to treat, says UC San Diego PHRI member Timothy Furnish, Associate Clinical Professor of Anesthesiology and Pain Medicine. The possibility that psychedelics could reorganize pain pathways in the brain holds out the promise of a much more long-lasting treatment than current medication can offer. The response rate to the current treatments is very low, James Close told Vice. Close is a doctoral student at the Centre for Psychedelic Research at Imperial College London and a pain management therapist at Imperial College Healthcare NHS Trust. Opioids can alleviate pain while patients take them. But as soon as the drugs wear off, the chronic pain returns. Anecdotal and preliminary empirical research shows psychedelics may relieve pain over the long term. Psychedelics could create plasticity and, so to speak, allow for the slate to be wiped clean, says Close. Looking at the depression and PTSD studies, you can see quite conceivably how psychedelics might help people change the relationship they have with their chronic pain. Indeed, preliminary findings from the PHRI indicate that psychedelics can significantly, meaningfully, and perhaps even permanently reduce chronic pain caused by conditions like cluster headaches, complex regional pain disorder, phantom limb pain, tinnitus, and more. As a non-addictive alternative to opioids, psychedelics represent a revolutionary and much-needed new approach to the treatment of pain, according to the PHRI at UC San Diego. The CDC estimates that more than 100 million people in the United States experience chronic pain. A quarter of people seeking primary health care suffer from chronic pain. Chronic pain is a leading cause of disability. A quarter of people seeking primary health care suffer from chronic pain. Going forward, chronic pain is a huge and growing problem in the United States. Unfortunately, the legal treatments currently available to sufferers are not only often inadequate but carry significant risks of dependence. The drug war has created an opioid epidemic, caused by an undertreatment epidemic that pushes people suffering from chronic pain toward dangerous street drugs or even worse solutions. Veterans are disproportionately impacted by both chronic pain and the overdoses and suicides related to undertreatment. Research indicates psychedelics may work better than conventional treatments, without as many risks. It's incumbent on the federal government to remove the barriers to research and treatment so that we can help ensure no one has to suffer needlessly or take unnecessary risks. Thank you for watching this video by Rapid Mental Healing for Veterans.